just before you go on that, I think so a lot of people haven't tried this MB2 Blackjack file, and it's like, so from my experience so far, it's been brilliant for getting into MB2s, it's been brilliant for getting into mid-mesial canals, it's been brilliant for getting into calcified canals. So, you know, you can see where the canal used to be, and you just need to get that little initial coronal calcified piece of tissue out. So in my experience, when you see people trying to navigate those, they use so many hand files, and they go in and they bend them, and it's a very kind of slow, laborious process, where it's like, just in terms of efficiency, that speeds up that initial entry into the canal system. Like, it saves so much time.
It's crazy. And because of the 17 millimeter length, it's
exactly, that's
it's short enough you can get you a small mirror behind it, so you can see the tip going into the orifice. It's really hard to poke around until you slip into it, especially if it isn't opened up. So that's a good thing. Do you want to show the close up here?
Yeah, that's
Chris,
great.
Can you switch to that?
Yeah, we see it there now.
So, are they seeing that now?
Yeah, we can see it now.
So this is a 4-sided file. It's a 1505, and it's the only file in our entire series that has what we call a dynamic tip. It's not an active tip. It doesn't have a cutting edge at the transitional angle, but unlike the rest of the files, which actually look like a duckbill, they're so passive. This one will help you get around some calcifications, intracannular calcifications, cervical impediments. It's a combination of the heat treatment, the 4 sides, and the tip geometry and the length that make it so effective. So I use that in every molar case. That's my first instrument in canals.
Yeah. I think it's
what else?
And I think as well.
So then we have the rotary negotiation concept, which is if you can get a handpiece, like a cordless handpiece with an apex locator in it, that makes it even cooler, because you're going to quit worrying about what your estimated lengths are. You're going to just put it in there, let it cut, pull it out, look at it, clean it, make sure the flutes are okay, put it back in there, it cuts, and you just repeat that until it just goes and stops, like instantaneously, more accurately than I could ever place that file. And now it's also slightly bound the canal, because I'm not having it back up or do reciprocation or anything. I just want it to just stop right there. Then it's stable in the canal, and I can goof around with the stop and get it perfectly positioned without ever moving the file. When I do it by hand, it's really hard not to move the file as I'm trying to move the stop. So that's a great thing. And it's also so amazing when you have the apex locator ground lead on the handpiece, you don't turn it on and off. When you put the tip of it into the lubricant, it's like starts immediately. When you pull it out, it stops immediately. So you don't have to like hit the button and then look at it. It's like immediate. So your productivity goes up even further than not using hand files. So of all the things I've done in the last 5 years, this is the most productivity enhancing change in my endodontic procedure is rotary negotiation. And it doesn't work with heat treated files. It doesn't work with the wrong geometry.
Yeah, no, absolutely. And I think it's, so a couple of people have tried them, and their initial feedback was like that like 1503 in difficult canals has been like frighteningly quick how well it can like just get to the apical stop, rather than the traditional way of how people are still been taught is like hand filing up to size 20. It's like crazy with the kind of technique.
Well, and if you start looking under a microscope at a cleared teeth or clear replicas and what happens with a hand file during negotiation versus a rotary file, it's not that the rotary file is safe as a hand file or as good as a hand file. It's way far superior. It is so much better than hand filing. With hand filing, we're watch winding, push pulling, watch winding, push pulling. So we're cutting debris, we're cutting the pulp, we're cutting the dentin, and we're leaving it all there. It's all just